You're muted, Commissioner.
You're muted.
Sorry about that. I think that's going to be the term for the 2020. You're muted. So we'll start this over again. I'm Berks County Commissioner Christian Leinbach, welcoming you to our board meeting for August the 27th of 2020. We will begin with a moment of silence followed by a pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We're going to begin this morning with a presentation from Brian Gottschall. Brian is our director relative to COVID-19 data and a mid-action report. Brian Gottschall.
Good morning, Commissioners. Thank you. And Commissioner Leinbach, your audio dropped out just a moment there, so I'm going to fill in that hole for the viewing audience. What I'm going to present this morning are just a couple slides with respect to some data relative to COVID in Berks County. The commissioners have asked that we do this as a weekly thing at each of their commissioner meetings. We're of course never going to want to make this into a 5 or 10 minute presentation, but we likely will add a couple more slides in future weeks as we vet some of our information with DOH. So for our technical team, I'm going to show my slides. If you could put that on the screen for the live view. Are we live with that?
Yes.
Okay, great, thank you. All right, so as I said, just a very brief presentation about data specific to Berks County to kind of help our folks in Berks County not have to sort through everything that's out there on the internet. What we're presenting to you here is not data that Berks County or Berks County DES kind of makes. We're consuming data made available by the Department of Health, and in some cases just showing it to you in a little bit of a different way that may be more of interest to you as a Berks County resident. This first screenshot is from the PA Early Warning Dashboard, and unfortunately there's not an easy URL to get to this. I find the easiest way to get there is just to go to your favorite search engine, Google or whatever, and do a search for PA Early Warning Dashboard, and it will get you to the state DOH's link that allows you to see all of this data. And the objective of this page is to allow a viewer to look at either the state as a whole or a specific county in the state in a snapshot and see some of the big picture metrics and how they're moving for the area that you're interested in. One of the downsides of this is that DOH only updates this on a weekly basis. So the data that I'm showing you right now is data that was published, is on the page right now, but it was actually new as of last Friday. And then tomorrow, we'll see it updated again for the next 7 days. And what we're looking for here is all of these arrows to be down or horizontal. You know, we obviously want things to get better, go in a downward direction, or worst case scenario to stay horizontal, indicating we're keeping the curve flat, we're not getting things worse. I'm not going to go through each one of these data points in detail and explain what they mean because I think they are pretty well described on the webpage. But again, a very nice snapshot of the various things that we're trying to have an impact on in each county in the Commonwealth and how Berks is faring out. The other graph or the other chart that I want to show this morning is a chart that we actually craft here at DES. And again, we're not making up this data. We're getting the data that makes the chart from DOH. But this chart allows us to put both our case counts, our new cases, as well as our testing on a single graph and look at how those things are moving together. And you'll see two green goal lines. The low one is our case goal. DOH has indicated that based on a requirement of 50 cases per 100,000 residents over a 14-day period. We want to stay under that green line. Unfortunately, we're not under that green line right now, and we have a small upward trend in that. We can actually almost directly correlate the going back upward again with the end of the severe mitigation, the stay-at-home order, if you will. So it certainly is understandable that where we had a lot of people who were attempting to comply with that mitigation order, not going out and about, and then we changed that when the county went to green. I think that everybody fully expected to see an increase in case counts as people move around and get together more. But our objective is to keep that case count as flat as we possibly can. And equally importantly, we want to keep our testing numbers up. Again, the Commonwealth has given us a goal of 1,960 tests over a 7-day smooth period. And the orange line at the top and the green goal line there is related to that testing. And that shows over a 7-day period how many tests are being administered in Berks County. And we definitely see that number going up and down a bit. And I think there's a lot that has to do with that. I know that I can't say that I fully understand all the things that impact that number, but something as simple as when the tests go to the laboratory, they work on the ones from Montour or Chester County today and don't get to a lot of the Berks ones until tomorrow. Or weekends certainly have an impact on people going and getting tested. So we do see those numbers going up and down on a daily basis, but this graph allows us to smooth those severe ups and downs and see them in a more gentle fashion. The important point is we're doing a lot of testing in Berks County, well above our DOH set goal, and that's a great thing. So as I said, in future weeks, we hope to have a couple other graphics that we can show to the public in an effort to help you better understand how things are being tracked here in Berks County. Anything else, Commissioner? Any questions from the board?
Any questions for Brian? Okay. Thank you very much, Brian. And speaking of questions, I want to note that if you have a specific comment on an agenda item, please post that now. If you can note at the beginning of your comment that is an agenda item comment, when you post, we need your first and last name and the municipality where you reside. With that,
I'm sorry. Is Brian gonna bring up the mid?
Oh yes, that's right. The mid-action report, Brian. Are you going to give an update on where you are? This is the mid-action report for COVID-19.
Yep, I apologize, Commissioners. I thought that we were doing that later as an agenda item. I didn't realize that was in the beginning. So again, just wanted to make the public aware, and as the commissioners are aware, because we spoke about this briefly yesterday, our department has been working on putting together what we're calling a mid-action review. It's pretty common in the emergency services when you have a major incident or event, you have what's called an after-action review. And a lot of times that's key players from the various agencies that are involved sitting down in a banquet hall or in a big meeting room and kind of walking through the incident and talking about successes and failures in an effort to try to ensure that, if a similar incident happens again later, there's an improvement in the way that that incident is addressed. Clearly, in what we're dealing with today, I don't think that we can say it's a normal emergency or a normal disaster. This is different than what any of us have ever dealt with before, and it takes a little bit of a different way of looking at things. But with that all in mind, our intention, my apologies, my cell phone's ringing. Sorry about that. With that all in mind, our intention is to do what we're calling a mid-action review. And the objective is to allow us to change our practices and procedures prior to a potential fall, winter, second surge of COVID. And we're kind of couching this not only in potential change for DES or even for the county as a whole, but we'd like to try to draw out for all of the participants in this how they may do things differently. So another thing that's different about this than an after-action review that we would normally do is the vast number of people who are involved in this. we're attempting to put together a list, and frankly, to be honest with the public, we thought we did a great job putting a list together, and yesterday showed it to just a small number of people and realized that we missed probably 8 or 10 key players that should have been on the list to begin with. So that just goes to speak to how vast the engagement and the involvement of the community is in this. It's going to be many, many more people than we would ever be used to doing. But we're trying to get that list together. We're going to send out a written survey to all of the folks who are identified as key contacts on that list. We're looking at emergency services, municipalities, long-term care facilities, personal care facilities, our acute care hospitals, social service agencies, and I'm in the verbal list there. I'm even missing a lot that we already have on the written list, but it's a large number of people. We're going to ask those folks to respond back to this survey. And we understand that the survey that we're sending out is a little bit lengthy. It's a little bit detailed. But as I said yesterday, we're not talking about a one-alarm fire here. We're talking about an emergency, a disaster of complexity beyond anything that perhaps even our nation has faced, short of perhaps a war. And that unfortunately speaks to some need for complexity and some need for commitment by our partner agencies to spend a little bit of time answering the questions. We're then going to follow up those questions with some key interviews. We're certainly not going to be able to interview every person that submits a survey, but we're going to select some folks based on the input that we get and do some telephone interviews and roll all of that together into the best that we can, a mid-action report, which will then be made available for folks to review. Again, hopefully helping to drive some positive change and improvement in a potential second wave of the virus. Muted, Commissioner.
Any questions or comments for Brian Gottschall?
Other than a comment, I hope that all of those agencies really take the time to fill out this mid-action report so we can do as good a job, if not better, going forward as we get into this fall and winter season. Thank you.
Very good point, Commissioner. Thank you very much, Brian. We will move into our agenda. First of all, are there any additions or corrections for the August 20th Commissioner meeting minutes and the August 25th operation meeting minutes? Hearing none, those minutes will stand approved as presented. I do want to note that we had an executive session on August the 21st, and that dealt with litigation. Mary, are there any public comments on specific agenda items?
I do not believe there are.
Okay, thank you. We will move to item 1, authorizing, under that, Budget Department, adopt a resolution authorizing 2020 budget transfers in the amount of $246,566 and 2020 appropriations in the amount of $595,159 per listing dated August the 24th of 2020. We have a couple of items under Human Resources. Item 1, authorize the utilization of a temp agency for 8 voter registrar 2 positions in election services. Item 2, authorize the promotion of Lauren Irby from Office Support 3 to Office Support 4 in the jail system. We have several items listed under the Commissioners. Item A, adopt a resolution authorizing execution of the PCCD grant application for Victims of Crime Act and the Victims of Juvenile Offenders funding for the Berks County Juvenile Probation Office Victim Witness Assistance Unit in the amount of $214,362, commencing on January 1st of 2021 and ending December 31st of 2022. Item B, adopt a resolution ratifying, confirming, and approving Justin Luce, Chief Information Officer, to electronically execute the membership agreement with Cybersecurity Collaborative, a Delaware corporation, a 1-year membership for 2 members of the County Information Systems Department with person-to-person calls and communication collaboration with cybersecurity industry leaders. This is offered at no cost to the county because of the county's membership with the National Association of Counties. Item C, adopt a resolution ratifying, confirming, and approving execution by the chair of the letter of intent between the County of Berks and Douglas N. and Annette M. Donnelly regarding the proposed sale of a 2.32 acre parcel owned by the Donnellys in Bethel Township. This parcel contains a radio tower owned by the County of Berks. Item D, adopt a resolution authorizing Kevin Barnhart, Vice Chair, to execute a change order number 29 to a contract with Motorola Solutions in the amount of $12,617. This change order is for replacement and installation of a damaged console located on the 19th floor of the Berks County Courthouse. Item E, adopt a resolution authorizing execution of the addendum to the lease agreement between the Township of Exeter and the County of Berks, extending the lease agreement for an additional 1-year period beginning January 1st of 2020 through December 31st of 2021 for property located at 10 Fairlane Road, Reading, PA, and used by Magisterial District Court 23-2-03. Item 2, a motion authorizing execution of contract agreements and amendments as furnished by the contract coordinator as set forth on the attached listing dated August the 25th of 2020. There are a total of 23 contracts, 1 contract jointly with adult probation, juvenile probation, the Berks County Jail, and the Berks County Sheriff's Office. 1 contract with Career Link, 14 contracts with Children and Youth Services, 1 joint contract with Children and Youth Services and Juvenile Probation, 2 with Mental Health and Developmental Disabilities, 3 with Human Resources, and 1 with Purchasing. And item 3, a motion to ratify and confirm payments as set forth on the Controller's Office voucher listing dated August the 25th of 2020 and the payment of electronic transfers and employee payroll.
Motion to approve the agenda as presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The motion is carried. Our treasurer, Dennis Adams, is not available today, so I will briefly go over the treasurer's report. The general account total is $217,159,624.63. There's a balance to clear of $2,824,947.22, leaving a balance of $214,334,677.41. Also noting that the CARES Act money balance is $37,801,734.69. And with that, we'll turn to our County Controller, Sandy Graffius, with the Controller's Report. Sandy?
Good morning, gentlemen.
Good morning.
Total accounts payable, there was no payroll this week. Total accounts payable is $7,101,089.96.
Thank you very much, Sandy. And we'll now turn to our Chief Administrative Officer, Ron Seaman.
Thank you, Commissioner. The only thing I would like to emphasize is the action taken today under Resolution 297.2020, authorizing the temporary positions in the Elections Office. We need to do this through a temporary agency to be in compliance with our collective bargaining agreements. So anyone who's interested in looking at one of those positions, I would urge you to contact our Human Resources Department. Their number is 610-478-6118 and extension 5102. They'll give you the pertinent information of the agency to make application for those positions. We do need the extra help to process the volume of mail-in applications that have been coming in. And that's all I have.
Thank you very much. We'll turn now to Commissioner Kevin Barnhart for his report.
Thank you, Commissioner Linebaugh and Commissioner Rivera and everyone who's joined us today. Just to add a little bit to what Ron had pointed out, we do offer to ASME employees before and after their shift to also work in election services as part of the collective bargaining agreement. Under contact tracing update from yesterday, we still have 6 functioning teams in place with Co-County Wellness. August 27th, tomorrow, there'll be a part-time paid personnel and community volunteer training, limited to 10 people based on distancing. So far to date, we have 916 contacts in the database. 111 have refused contact services, which is 12%, but 48 of those 111 only refused by the time they were entered in a SharePoint database. The isolation period for the positive test and the quarantine period for close contact was over. So it puts our true refusal rate at 6.8%. The database of 916 represents an increase of 163 new contacts in the past week, or about a 21.6% increase in contacts. There is a shared vision for community healthcare equality and commitment for supporting diverse and underserved communities. PA Department of Health, Highmark Blue Shield, Independence Blue Cross Foundation, and the Latino Connection have partnered to create the first of its kind COVID mobile response unit with the unified purpose of building healthy communities through accessibility to knowledge and care. To note, the unit will be in the Reading YMCA on September 11th from 11 to 3, and the Sinking Spring YMCA from September 12th from 11 to 3. Alvernia and Kutztown will be relying on Co-County Wellness Services for their contact tracing. They spoke to Dr. Williamson and Dr. Westner at Albright and will be assisting with their contact tracing as well. Both Albright and Alvernia have the Abbott ID testing machine on order and plan on running their own on-campus testing once received. For now, they will be sending their students to Penn State St. Joe's for testing. Just an update on the Co-County Wellness contact tracing in the community. Want to jump into updates on election services. Mail-in ballots for the primary applications for mail-in ballots total 38,000. As of this morning, we've received 48,000 applications. It's August 27th. We received 10,000 more already than we did in the primary. At 11 o'clock, we will have our election board. So if anyone wants to tune into that, since everyone seems to be very concerned about election and election integrity, we have on that agenda to rent the room at the Doubletree to help us assist in opening ballots, discuss compensation for county employees to work on election day to open ballots, and discuss the Department of State new layout for division of poll books. Also compensation for 6 county workers on election day to rove and work at the polls, at the 202 polls, and to actually have appointments. There's been a request for people if they can come into election services and apply for an application and at the same time receive a ballot for their respective precinct. We'd like to advertise up, but we also would like to advertise if people need to make an appointment. And last but not least, someone actually submitted a false voter registration form, which we need to discuss as an election board. And 2 other things of note are this board has again requested of our legislators in Harrisburg to waive the penalty for unemployment compensation benefits so we can then encourage additional people who are still unemployed to work during election day. And at 1 o'clock, there is a call through Harrisburg, and Debbie Oliveri is going to be on that call, proposals for safe and secure elections. So I can't be on that call. I'd like to be, but Debbie's going to be on that call at 1 p.m. to find out what Harrisburg is offering in the way of safe and secure elections. So stay tuned for that. Just a quick update on the CARES Act. This board, with the assistance of others, Whit O'Brien and Helping Harvest, on Tuesday at our operations and budget meeting, created a food insecurity allocation through the CARES Act, which will be $600,000 per month for August, September, October, November, December, to hopefully to assuage the need for food purchases for Helping Harvest and the food pantries in our community. Tuesday's budget ops meeting coming up next Tuesday, I hope to have a proposal as to how to allocate the balance of the money through the next few months of CARES Act money, and basically to do similar to what we're doing with the New Start with businesses, the food insecurity with Helping Harvest, to have some proposals for my colleagues to consider for Tuesday as we move this money out into the community as quickly and as paperwork intense as possible. So if Mary would like to put that on the agenda for Tuesday, I would appreciate that. And again, census is, as of today, only 35 days away. So I'm sure everyone on this call has completed their census, but if you know of anybody, do your outreach, get everyone counted in this community. It's a significant missing federal money that should come back to Reading and Berks County. So I'm imploring everyone who knows anyone who has not completed their census form to please do so. Thank you so much.
Thank you very much, Commissioner Barnhart. We'll turn now to Commissioner Michael Rivera.
Thank you very much, Commissioner Leinbach, and thank you, Commissioner Barnhart, for the information that you shared. Commissioner Barnhart spoke about allocating money for food insecurity. Just want to let everyone know that this morning from 10 to 12 noon time at Hope Rescue Mission, there will be a drive-through event in which Feed the Children and Price Right partnered with the Hope Rescue Mission, and they'll be providing food, a box of hygiene items, including food in the, includes fresh produce, Disney children books, and backpacks filled with school supplies to anyone that goes there between 10 and 12. It will be held, there's being held at Hope Rescue Mission at 645 North 6th Street. What you do, and they have it set up so you go in through one of the entrances, you stop the car, you open the trunk, the volunteers put everything in the trunk for you, close the trunk, and you drive away. So they are following the safety protocols there, CDC guidelines in reference to social distancing. So if you do have a need for food, for hygiene products, or for school supplies for your children, please make sure you go there between 10 and 12 o'clock today. Or if you know of anyone, or you're part of an organization where members of the organization may benefit from this, please make sure that you are there. Again, I want to thank Feed the Children, Price Right, and Hope Rescue Mission for putting this together. This is a great initiative, a great opportunity to serve our community here locally. And I also want to thank all the volunteers that were there this morning, helping organize, get things up, and the ones that are there now, putting the items into the people's car. So thank you very much. Want to remind everyone as well that we have the rental assistance programs, and there are also mortgage assistance programs through PFHA. So if you go to the PHFA website, you will find assistance on the mortgage programs. For rental assistance program information, you can contact the Berks Coalition to End Homelessness. You can go to their website as well for more information. Their programs there are to help both tenants and landlords as well. So please, if you know anyone who is having issues paying their rent because of COVID, or if you know of any landlords that have mentioned that they have tenants that have not been able to pay their rent due to COVID related issues, please have them reach out to the Berks Coalition to End Homelessness. Also in the Rebuilding Berks, I've been speaking about that as well. The different initiatives in reference to helping our businesses grow back here in Berks. I just wanted to update on the Small Business New Start Grant Program, which was set up as part of the Rebuild Berks, and it's part of the funding that came through the CARES Act. There have been $6 million allocated for the New Start grant program. The grants will be in the amount of $10,000 to $50,000, and that will be based on the business's need and their annual gross revenue, annual gross sales. In this specific program, we're allowing up to 50 full-time employee equivalents and up to $3 million in gross revenue. The state program, which is also open now until tomorrow, they only are allowing up to 1 million in gross revenue and up to 25 full-time equivalents. I also want to remind you that there is still funding available from the Small Business Restart Grant Program, which is being run by Neighborhood Housing Services of Greater Reading. So what I'm trying to say is there is help out there. We need help in getting the word out and talking with your small business owners, people that you may know, and helping share this information. So if you can please help that get this word out, I'd greatly appreciate it. There will be more information on the New Start Grant Program next week. There isn't anything out there yet on the web or on the Community First Fund website, but that will be out there shortly, so please stay tuned. Also want to thank Election Services for all the hard work they've been doing. Just the numbers that Commissioner Barnhart mentioned, as of now, there's 48,000 requests. That's a lot of work processing all those, and it will be a lot of work also when they start coming in, and on election day they have to be counted. So Election Services, thank you for all that you're doing, Debbie and your team there. Great work and always ensuring that things are done properly election-wise here in Berks County. Thank you very much. And to finalize, I just want to give a brief update on me. I want to first of all thank those of you who have reached out to me via text, call, email, message, the various ways, and have wished me well. Just wanted to let everyone know that I am feeling well. I got the all clear from my doctor, and I'm looking forward to getting back to the office on Monday. I have been working from home, but I am looking forward to get back to the office on Monday. So again, thank you for all those who wish me well, and I am feeling better. Commissioner Leinbach, back to you.
Thank you very much. A couple items that I want to touch on. Yesterday, I recorded a program for BCTV along with representatives from Penn State Extension on the almost forgotten spotted lanternfly. We haven't talked about that often on this program, and understandably why, because of the crisis of COVID-19. However, there were two things I wanted to highlight. One, many will remember that there was a discovery at Angora Fruit Farm, property that's part of Antietam Lake Park, County Park, that a fungus that was devastating and is devastating to spotted lanternflies. I asked for an update on that, and unfortunately that is not yet in production. It is still being researched, and it makes sense. They want to make sure that before they put something out that the cure isn't worse than the disease, so to speak. However, probably the biggest bit of new information, Brian Walsh actually from Extension shared this, that the strategy has fundamentally changed with the spotted lanternfly to a goal. There's a long-term goal still of eradication, but short-term over the next number of years is management. In much the same way, things like the Asian beetle, Japanese beetles, gypsy moth have been managed. That's what is taking place right now relative to the spotted lanternfly. The area has expanded significantly. The quarantine for Pennsylvania. There are also other states, New Jersey, Delaware, Maryland, Virginia, that have been impacted. But it was a good program, and those were two of the takeaways that I received as part of my involvement in that program. I also want to highlight There have been a lot of comments about the events of the last week and various people weighing in on what I should or should not have done. And I want to make folks aware that last Wednesday, I participated in a groundbreaking up at Berks Park 78. That was set up where everyone was socially distanced, chairs were apart from each other, everyone was masked. I did not have any close personal contact with any person at that event. Close personal contact by CDC and Pennsylvania Department of Health is defined as 6 feet or less, 15 minutes or more. And I would dare say the max that I had in any conversation at 6 feet, maybe a little bit further, would be about a minute. I found out on Saturday that Congressman Muser had tested positive, and it's important, I found out from a reporter that called me. I was not contacted by Congressman Muser or anyone doing contact tracing, and the reason was because I was not in close personal contact. Having been very engaged in this, I knew what the rules were as far as quarantining. You don't quarantine unless you've been in close personal contact. You don't go out and request a test unless you've been in close personal contact. However, because of some of the criticism that was raised when Commissioner Rivera contracted COVID-19, criticism aimed at Commissioner Barnhart and myself, I responded to the reporter that I would reach out to my family physician and follow whatever advice my family physician suggested. On Monday, my family physician responded and said, you do not need to be tested unless you have symptoms. I told them I have no symptoms. And then my family physician said, as a result of taking my case and referring it to a COVID-19 panel, and my physician is connected to Tower Health, the panel recommended that I quarantine. That is not consistent with CDC or DOH guidelines, but because I made a commitment that I would follow that direction, I am now quarantined. People have questioned, why did you go to the event on Sunday at Robisonia? I will note that again, I was socially distanced. I was wearing a mask except as I was getting ready to speak and when I did an interview with 69. I did not interact with the crowd. I was across the street from the crowd. And again, I was there in light of the event because of the CDC regulations. And again, I'll reiterate what those regulations say. You don't need to be tested unless you've had close personal contact, and you don't need to be quarantined unless you have close personal contact. The reality is I am quarantined because I made a commitment to Karen Shuey when she called me on Saturday that I would do whatever my family doctor recommended. And that's my answer. My reaction is not cavalier. My response is not one of recklessness. I'm trying very hard to do each day what I believe is the right thing based on the information I have. And that's all that I can commit to do. I know that some people have a problem with that. I am responsible to do what I believe is right, and that's what I've chosen to do. Hopefully, that explanation will provide you with additional detail. With that, we will open it up. Are there any comments from our row officers?
Commissioner Linebaugh, this is Mary Kozak. I have a comment.
Yes, Mary Kozak, our recorder of deeds, please go ahead.
Sure. Well, good morning, everyone. And I just wanted to make a statement due to an unforeseen transition in that the transactions did not appear in Sunday's Eagle. A solution is now in place, and the transactions will again be seen starting with this Sunday's edition of the Reading Eagle.
Yeah, and you're talking about the property transactions that come out through the recorder of deeds office.
Yeah, something happened in there. So together I worked with the Eagle and we came up with a solution.
Okay.
Okay, so they will be seen again. And I thank you for your understanding.
Very good. Thank you.
Thank you.
Okay, with that, we will go to public comment. We'll turn to Mary Buer to share that public comment. Mary?
Thank you. Crystal Kowalski, why I'm missing. Good morning, commissioners. The Reading Eagle has reported twice this month that Amazon plans to bring fulfillment centers to both the Charlottesville area and Muhlenberg Township. Has Amazon received any of the following to entice them to develop here? A direct monetary subsidy, tax exemptions through LRTA, local property tax abatement, state or local tax subsidies, state or local grants, sales tax sharing agreement. If Amazon has received any of the above, can you please explain which they have received and the amount and the details of their subsidy? Thank you. Christopher Ellis, Reading. Governor Wolf announced he is extending 6 weeks of paid parental leave to all Commonwealth employees in order to deal with child care issues that they may be facing. Will the commissioners do this important action for county employees as well to make sure that workers can properly deal with family care issues? Louise Grimm, why I'm missing. So sorry that 2 of you have either been infected or exposed to infected legislators, despite the fact that we are sure you took some precautions. That just demonstrates how contagious this virus is and how no one knows who is infected and liable to transmit it, perhaps even without showing any symptoms. That is why we are again begging you to shut down the Berks Detention Residential Center. Every worker or person entering the center is susceptible to transmitting a dangerous virus they are unaware they have. We know that despite efforts to contain the virus in confined facilities, the virus continues to infect people and that Berks County cases continue to rise. Yesterday, we had 42 new cases and our 14-day average was 33 and 7-day average was 35. Numbers we have not seen since May. In addition to complicate matters, the flu season is upon us. Please do not wait till some innocent person gets sick or dies in our facility, not to mention the harm that this is causing to the children. We have people who are willing to take these people. And what are you actively doing to continue reaching out to the state or private entities to make other use of the center? All of you should be working on this. This should be a priority. Think of your innocent grandchildren being fenced in. Also, Commissioner Linebaugh, for your sake and the sake of those around you, please get tested to make sure you are all safe. Saeed Ahmed and why missing. Thanks for your robust discussion last time related to the upcoming election. Election integrity at the local level is not a problem. Berks County officials will process ballots just fine if received. However, your statement that people's focus on the U.S. Postal Service is to set up a narrative in case Trump wins was false and irresponsible. The only person who has challenged the outcome in advance of the election is President Trump. He has filed lawsuits. The strategy seems to be working. You said yourself that you aren't providing more drop boxes because you fear being sued by Trump. Trump admits, as printed in the Reading Eagle on August 14, that he has blocked funds to the post office to stop mail-in voting. Your mention of a $10 billion fund that isn't being used, excuse me, was beside the point. Trump appointees DeJoy will not allow use of these funds. I am not challenging you to set up any false narratives. I am challenging you because we get daily reports in the news about issues with our postal system caused by Postmaster DeJoy. Let's put the blame in its proper place. Please stop making it seem that trying to make it safe and convenient to vote is a bad thing. I am concerned people will not vote or that ballots will not get to the county. I am concerned people will be unnecessarily exposed to COVID as they vote in person. When federal authorities fail, sometimes local authorities have to step up. In Oklahoma, green absentee envelopes are being printed to help the United States Postal Service. Please do what you can to take the load of the USPS and poll workers Please do what you can to take the load off of the USPS and poll workers. Please tell me again why drop boxes at police stations are not secure. Commissioners, I beg you to make voting as convenient and safe as possible. There is nothing wrong with that. Please provide additional drop boxes in police stations for the safety of contactless voting. Please step up and protect democracy. Thank you. Risa Marmontello, Amity Township. First of all, wishing all of you good health. Several counties in southeast Pennsylvania have established multiple drop boxes for mail-in voting. Neighboring Montgomery County has 10 locations, some set up in locations with video surveillance so they do not have to be staffed. Why can't Berks County set up locations like that? Jane Palmer, why missing? A federal judge has ordered a stay in President Donald Trump's re-election campaign lawsuit seeking to ban mailed ballot drop boxes and other changes to Pennsylvania election procedure. Fear of this lawsuit was the main reason you offered for not providing ballot boxes throughout the county, and now it's gone. According to a Philadelphia Inquirer article from April of this year, Commissioner Linebaugh said he wanted the entire county to be able to vote by mail in the primary. You said, and he quotes, "I believe we need to make voting in the current health crisis as safe as possible." That was then when we were still completely shut down. While we are less so now, health and access concerns are still very real to a lot of people, and yet your enthusiasm for making voting easier seems to have dropped off. Yet you are unwilling to make it more accessible in the midst of a pandemic. Just because it's easy for you to cast your ballot doesn't mean it's easy for everyone in Berks, and shaming voters is not helpful. Given that the president's actively disparaging voting by mail, even though the party is actively promoting it, and his appointed Postmaster General DeJoy has done considerable damage to the functioning and trust of the U.S. Postal Service, your constituents deserve your support in the form of additional ballot boxes in Berks. Becky Ellis, Reading, PA. Commissioner Linebaugh, in an August 23rd, 2020 article of the Reading Eagle entitled, quotes, "Robesonia Rally Shows Support for Area Police Officers," quote, you had noted that Sheriff Weekneck had declined to speak after being exposed to someone who tested positive for the coronavirus and was self-quarantined. 2 days later, in an August 25th, 2020 article of the Reading Eagle entitled, quote, Berks County Commissioner criticized for attending rally after finding out he may have been exposed to coronavirus, end of quote, it is noted that you were aware that Representative Dan Muser had tested positive for the coronavirus, but that you attended the Robazania rally anyway. With the Berks County Park Board meeting minutes that were sent out on August 25th, 2020, it is noticed that you stated, in quotes, we are trying to set the tone for the community for how to conduct business. Limitations on access to services center, many county staff teleworking, so we were being consistent with our message. That should be end of quote. Currently, the gathering restrictions are 25 for indoor, 250 outdoors. Now it's the end of the quote. It was also noted in the minutes that, again a quote, Commissioner Leinbach expressed appreciation for the support of the programming opportunities our staff has provided, but we need to be consistent in our message of limiting group gatherings countywide, end of quotes. I fail to see how laying off 3 employees, Becky Richards, 19 years, Becky Hughes, 17 years, and Sue Ettinger, 25 years, translates into keeping the public safe when the outdoor programming for Berks Parks and Recreation could easily have been limited to under 250 people, all wearing masks and social distancing. Instead, Commissioner Leinbach, you attended a Back to Blue rally, which is a snub of the Black Lives Matter movement, in which most of the 400 people that I saw in photos were not wearing masks or were wearing them improperly. In addition, you have had prior knowledge of being in close contact with someone who had contracted COVID-19. And instead of setting an example for the county, you went to a rally of 400 people, well over the 250 limit for outdoor gatherings. Today, my ask of you, Commissioner Leinbach, is quite simple. Rehire the 3 Berks Parks employees that you laid off. It is quite evident from your actions that they were not truly laid off for consistency of county messaging. It appears to be a way to sabotage the park system during a time when this county resource funded by taxpayers' dollars is most needed by our community. As a person living in a high-risk household, masked walks and hikes are the only activities that I can do that are nearly 100% safe. I ask that all Berks County Commissioners reevaluate this decision and rehire those employees. Without their knowledge and guidance, my love for Berks County would not be what it is today. Thank you. William Bellows, why I'm missing. Commissioner Leinbach, I am dismayed by your cavalier attitude toward testing. Do you not understand that you can be an asymptomatic carrier? It's almost as if you're politicizing the virus by promoting the GOP message that masking and testing are all for show. You are a public figure who has seen fit to show up in public spaces where hundreds of people are gathered. It is shocking that your response to known testing is not known exposure is not automatic testing. Jess Royer, Spring Township. Good morning, Commissioners. Of the almost 40,000 voters in Berks who voted by mail in the primary, it is very likely that there will be voters who receive a ballot by mail for the general election, but are not interested in mailing it in or dropping it off in the county services buildings. This is not a hypothetical scenario, but is based on my own personal interactions with voters who expressed that very sentiment to me. One of the reasons given for not accepting these ballots that voters have requested by mail and completed prior to November 3rd at the actual polling places was the legal challenge by the Trump campaign. Now that the Trump campaign's federal lawsuit has been stayed, is that matter being reconsidered? Thank you. Adrian Jadick, why I'm missing. Why a Missing Borough has opened the pool for about a month against common sense practice during COVID epidemic. Melvia Ahmed, why I'm missing. Thank you for your service to Berks County. I appreciated the detailed explanation of the election process provided by Deborah Oliveri. I feel it would be beneficial to Berks Countyans to know that precautions routinely practiced to protect our election system. Why are county commissioners meetings held at a time when many county citizens are unable to hear this valuable information? Andrea Jefferson, West Lawn. Pertaining to the August 23rd and 25th articles in the Reading Eagle about the Robesonia gathering, not only should Commissioner Leinbach have not attended, but also I would like to point out that there were over 400 people there, and I thought the governor's orders was for only 250. Also, not much social distancing and hardly any masks. As an elected official, you really should be setting an example so the numbers in our county can go down. Please work with other elected officials and help enforce the governor's mandates so we all can beat this COVID together. We need to put our differences aside and work together to beat COVID. And that is the last of the comments.
They just added one.
Oh, you're right. Okay. David Del Negro, West Reading. Commissioners, I understand the desire to keep drop boxes secure. After a vote by mail scandal close to my hometown, Paterson, New Jersey, the world is watching our election security closely. This has to be balanced against the need to improve access at the ballot box. Do you have plans to open drop boxes at secure locations in more rural locations for those who do not want to travel into the city? Get well soon, Michael and Christian. Stay safe, Kevin. Your leadership is appreciated in these hard times.
With that, we will close the comment period. Before I open it up to my colleagues, I would like to recognize Brian Gottschall and talk a little bit about this continued question on testing, who should be tested, when they should be tested, etc. Brian Gottschall.
Thanks, Commissioner. Obviously, I want to avoid any, personal situation between you and your family doctor. You've illustrated in your own case, why the decisions you made were made and that they were made under the advice of your doctor. But I'd like to speak a little bit about what the general guidance is that is available for anyone in the public. And both CDC and DOH are pretty clear in saying that testing should be limited to people who have symptoms indicative of COVID, folks who have had close personal contact, again, defined as within 6 feet of an individual who is known or believed to be COVID positive for 15 minutes, or individuals who are directed to receive COVID testing by their healthcare provider or a health authority. So an example of that would be serial testing that is underway in long-term care facilities and nursing homes throughout the Commonwealth, where patients and staff members are being asked to undergo repetitive testing due to the high risk related to those types of facilities. So what does that mean for folks who are not falling into one of those three groups? Somebody who just says, hey, I'm just concerned. I'm not symptomatic. I don't believe I've been in contact with anybody, but I'd really like to have a test just to know. So those folks are certainly able to get tested if they go to a healthcare provider or they go to a screening location and are able to get a script, a prescription for testing. So it's important to understand that you can't be tested without a prescription. What makes this a little bit confusing is that there's two ways to get that prescription. Number one, you could literally go to a doctor and have that doctor agree that you should have a script to get tested. Or number two, you could go to a community testing site where you still are going through a screening process. Either you're answering questions through a web portal, or you're answering questions actually being asked by an individual at that test site. And by virtue of your response to those questions, in essence, there's a prescription behind the scene given to allow your test to be processed. In some large jurisdictions where they're doing drive-through testing, again, it may not be obvious to somebody that there's a prescription, but a public health authority, a county or the state Department of Health, is issuing a standing prescription for folks to get the testing through that environment. I don't know if folks saw in the media, but I apologize. I don't know if it was yesterday or the day before, the Secretary of Health announced that Pennsylvania has purchased a mobile testing facility that they're branding as CATE, C-A-T-E. And that mobile testing facility is going to be traveling around the Commonwealth to various locations. It is going to be in Berks County next week, as I understand it. And there is going to be community level testing done through that mobile testing facility. Basically, you're going to be able to walk in and be evaluated by a public health representative. And if you meet their requirements, you're going to be able to get tested. So why is that kind of level of scrutiny still in place? Why do you have to meet certain parameters, answer certain questions certain ways, or have a prescription? The simple answer is, and some people might not like to hear this because this has become a very political matter, but testing remains limited. There's two components to testing. There's what happens in the field, there's the supplies that they use to actually take the sample from you, and then there's also laboratory capacity to process those samples. And in both cases, there are limitations. This is the reason it's taking, in some cases, 7 days or more to get test results back, because there's a backlog in the laboratory where those tests are processed. And for that reason, while I think everybody agrees, we want everybody that wants testing to be able to get tested. That is simply not practical in our environment today. And we need to make sure that we're not overwhelming our testing capacity, that we're making sure that there's capacity there for the people who most need to be tested to get tested, and to get tested in a rapid and efficient manner. So I hope that helps to kind of paint with some broad brushes what CDC and DOH are saying about COVID-19 testing.
Just to clarify your one comment, Brian, the mobile unit is going to be at the Reading YMCA September 11th and September 12th at the Sinking Spring YMCA.
Got it. 2 weeks. Thank you, Commissioner.
Okay. You're welcome. So everybody's aware of it, and if they need to go, they go.
Thank you very much, Brian. Any comments from my colleagues?
Just real quickly, Crystal Kowalski's concern about tax breaks and things for Amazon. We have come to find out Amazon is very secretive. And quite honestly, our Chamber Alliance, Pam Shook, didn't even know they were coming to town until it was announced in the media. But with respect to any kind of county taxes, we have not offered any rebate or any discount on county taxes. A LRTA basically generally is for improvements or new construction. So the facility they're going to be occupying in Muhlenberg Township is an existing building. I don't necessarily know if there's still a LRTA on there, because LRTAs go 11 years, but Muhlenberg Township is a LRTA township. I'm not sure about the one in Charlottesville. I really can't speak.
It's a LRTA. I checked.
Okay.
That's Hamburg School District.
And just so you're aware, they are doing, I think, upfitting of the building in Muhlenberg. I believe it's about $28 million of upgrades. That then translate to $450,000 of permit income for Muhlenberg Township. That's what I know about both locations. Christopher Ellis asked about, are we going to be offering childcare payment for county employees? Clarification. The governor has a proposal to do so for state employees. They would have to wait till the legislature comes back sometime in September to review that. But I would say, on behalf of myself and this board, we are extremely concerned, and we take everyone's case here as a county employee, case-by-case basis, if they have concerns with childcare issues. Last but not least, every week we talk about drop boxes. Again, it's called a mail-in ballot, so that means you mail it in. It wasn't for me solely about the Trump litigation, which is now stayed at this point. It was more about the actual security of these boxes. The idea that there's 10 boxes in Montgomery County, again, that's proposed. That was an article in the Philadelphia Inquirer a few weeks ago. that Philadelphia, Delaware, and Montgomery County are contemplating drop boxes. But I just don't understand why you think a surveillance camera or being at a police department gives you peace of mind that your ballot's going to make it to election services. Quite honestly, I spent 24 years in the borough of West Reading, and what we wanted our police department and our police officers to do was be on the street, not in the office. So I'm just wondering, if you ring the doorbell at the West Reading Police Department, say, can I drop off my mail-in ballot, your chances of getting an answer at that door is probably pretty nil. So I just, you know what, mail it in, and at 11 whatever, we're going to be discussing the opportunity for people to come in by appointment to election services, to get an application, complete the application, to get a ballot. I am not, again, going to approve putting any drop boxes out in the community, whether it's at a police department, a township building, or under surveillance camera. You know, a number of years ago, there was a machine error at one of our polling locations in the city during a council race. That became national news. One machine had an error in the cartridge. That became national news. I don't want to be here as a commissioner in Berks County and something happens to a drop mail-in box somewhere out in the hinterlands that becomes national news. That how dare those commissioners ruin the integrity of the election by putting a drop box out in Charlottesville. I just think, you know what? It's a mail-in ballot, mail it in. If you don't want to mail it in, then go to the polls and vote on election day. Thank you.
Thank you. Commissioner Rivera.
Actually, Commissioner Barnhart touched on the points that I had notes to touch on, so I will pass it back to Commissioner Leinbach.
I'll let you go first next week.
Thank you, Commissioner Barnhart.
I'm just going to touch on one item. I'm going to share my screen. The question regarding pools, hot tubs, water playgrounds. This is from the CDC. They have a whole section on it. And here's the key statement. There is no evidence that COVID-19 can be spread to humans through the use of recreational waters. Follow safe swimming practices along with social distancing and everyday preventative actions to protect yourself. And then it talks about it further. So it is not a foregone conclusion that public pools are a bad idea. Again, that's the data that is available from CDC. Anything else for the good of the order?
Motion to adjourn to an election board meeting.
Yep, we'll go right to the election board meeting. Meeting stands adjourned. Thank you for joining us.